Hi, my name's Gus and I'm going to show you a really cool way to make your canine teeth look smaller. Now some people have got quite large canines, so this is a great little technique to help you reduce the size of your canine teeth. Exactly the same way as we did for Linda here. So you can see from her before and after smile photos how big the canines are in the first photos and how small we've got them in the second photo. Now if we look at her before treatment photo, so the photo we took when she first came in, can you see how wide the canines look here? So this is what she absolutely hated about her smile, and it was affecting her confidence and everything. And this girl's, she's a model, she's a dancer, everything. So everything has to look really great, and this was affecting the way she smiled. So when you look at a really good looking smile, there's a few things, well there's a whole bunch of things really, but there's a few things I'm going to talk about now that will help make this smile look really amazing. So in Linda's case, the reason that the smile doesn't look fantastic is because the width of the teeth don't follow the golden proportion rule. So when you look at a really great looking smile, the front teeth, the two front teeth should have a certain width. Let's say it's 8mm. And then as you move away from the midline, the visible part of the tooth should become less and less the further away you go from the midline. And there's actually a ratio of tooth width that should be followed, and this is a ratio that's found again and again in nature. So this ratio is 1.6 to 1, 1.6 to 1, 1.6 to 1. So as you move away from the midline, the teeth get narrower and narrower. They also tilt more and more towards the midline. So these are two things that we need to follow when you're redesigning a smile to make it look really, really good. So in Linda's case, can you see that the canine tooth is much wider than the lateral incisor tooth? And also, because the canine is so wide, it's kind of obscuring all the teeth behind it. So this is distracting from harmony. This is what's affecting this smile. This is the biggest problem with this smile right now. So if we can sort that out, overall, she's going to have a great looking smile. So now we know what the problem is. Let's look at why this canine tooth is actually looking wider than it is. It's not actually a problem with the shape of this tooth. The tooth isn't abnormally wide. To understand this, we need to have a look at the bird's eye view of this tooth. We call this an occlusal view, and here it is now. And from this view, we can see the outline of this canine tooth, and I can see that it's actually rotated almost 90 degrees out of position. So then the question is, if we were to derotate this tooth, would it look thinner? And why would it look thinner? So to help understand this, let's do a little experiment. Right, so this is our experiment, and this is a rough outline of the canine tooth, and this is what we can see from the front here. And can you see these two markings here are kind of, they're depicting how wide the tooth looks if you're looking at it from the front. Okay, so this is the rotation of the tooth, this is the face of the tooth, and it's almost 90 degrees. So if I rotate this tooth this way, which is a more realistic position, can you see from the front, suddenly it looks a lot thinner than it did a minute ago. So we would actually have to move this white line there, and you've almost got like a 50% reduction in the width of the tooth. So now we understand the problem properly, we've got two solutions. There's two ways that we can make this canine look better. We could either rotate it, so every time we're actually moving the teeth themselves, we're looking at some kind of brace treatment, so this is orthodontics, whatever. Or we can veneer the tooth, so we can take the back edge of the canine tooth away, giving it the appearance that it's derotated, giving the appearance that it's not too wide, and equalizing this harmony in the smile. So when I spoke to Linda about her options, she much preferred a brace treatment option. Basically her friends had had brace treatment from me as well, so she was actually recommended by her friends to come and see me for braces. So we discussed the pros and cons of all of this, and because of her line of work and everything, she couldn't have anything which was visible. So when it comes to brace treatment, we can either have fixed braces on the outside or the inside of the teeth. So in her situation, a brace on the inside was much better for her. Now let's take a quick look at her lower teeth as well, and you can see that they're overlapping. We call this crowding. Because the teeth are overlapped and she's having braces for the top, she thought she might as well just go the full hog and just do top and bottom, which is a smart move, because once her top teeth are all done and look amazing, she'll probably notice the bottom teeth more. The next problem was budget. Lingual braces, the hidden ones, the ones on the inside, always cost more than braces on the outside, and we had to stick with a certain budget, and we're doing top and bottom teeth, so this is really pushing the boundaries out for her. So what we did, we used a reduced size brace, so we just concentrated on the front teeth with the top, and we used a ceramic brace which is placed on the outside at the bottom. So the one at the bottom, the reason we chose a visible brace there was just because the teeth themselves are less visible. You tend to only see the tops of the teeth. So she could get away with that, and because we were doing the shortened brace, just something really on the front teeth, it meant we're not going to affect the back teeth so much, and this does have a bit of an implication, but I'll show you that later. So after about 9 months of brace treatment, this is Linda's smile at the end, and we can compare it to where we started off, and you can see it's a massive difference. The proportions are correct now, the tooth inclination is correct. Instead of the canines kind of pointing outwards, they're now pointing inwards, and all of this is creating a lot of harmony in the smile. Another thing is, when you kind of improve the general look of a smile, and you sort out the most obvious thing, in this case the canines, other less obvious things suddenly become more obvious. For example, the chip in her tooth. So what we did, we just rebuilt this chip using a composite bonding material and polished it in really well so that you can't even tell that there's a difference between tooth and this composite material. After all this work, she was so happy with the end result, and you can see it's a massive transformation from one side to the other. If you want to find out more about cosmetic treatments that can completely transform your smile, your confidence, and absolutely everything about your life in some cases, please subscribe to my channel and like my Facebook page and all of that. If you want to actually find out where I work and come see me for a consultation, head over to my website and all the details are there. Alright, I'll see you later. Take care.